The all-on-4 treatment concept has revolutionized the field of dental implantology. It offers a fixed, full-arch restoration supported by just 4 implants. This approach is particularly beneficial for patients who have experienced significant tooth loss. All-on-4 restorations provide a stable and aesthetically pleasing solution for those seeking to regain their smiles and oral function. This innovative technique has become a cornerstone of modern dentistry, offering renewed hope for patients facing complex dental challenges. The procedure involves anchoring a full set of teeth to 4 strategically placed dental implants. 2 implants are placed vertically in the anterior maxilla or mandible. The other 2 implants are inserted at a 45-degree angle in the posterior regions. This strategic placement maximizes the use of available bone, often eliminating the need for bone grafting. All-on-4 restorations offer a time-efficient and cost-effective solution compared to traditional implant-supported dentures. One of the challenges associated with traditional all-on-4 restorations is the potential loss of proprioception. Proprioception refers to the body's ability to sense the position and movement of its parts. In the context of dentistry, it's the feeling we have of where our teeth are in space. This sense is crucial for activities like chewing and speaking. When a patient receives an all-on-4 restoration, the natural teeth are replaced with a fixed prosthesis. This prosthesis, while visually appealing and functional, can sometimes interfere with the transmission of sensory information from the mouth to the brain. As a result, patients may experience a diminished ability to gauge bite force and food texture. This can lead to difficulties in chewing and may even increase the risk of accidentally biting the cheek or tongue. To address the challenges posed by the potential loss of proprioception and to enhance the longevity of all-on-4 restorations, the concept of repairable bridges, such as the Malo bridge, has emerged. These bridges are designed with unique features that set them apart from traditional fixed prostheses. One of the key advantages of Malo bridges is their removability. Unlike cemented bridges, which are permanently fixed to the implants, Malo bridges are secured using screws. This screw-retained design allows for easy removal of the bridge by a dental professional when necessary. This is particularly beneficial for maintenance, repairs, or adjustments. Furthermore, Malo bridges allow for individual crown replacement. If a single crown becomes damaged or worn, it can be replaced without affecting the rest of the bridge. This modularity contributes to the long-term cost-effectiveness of the restoration. Section 4. Advantages of repairable bridges: longevity, function, and peace of mind. The benefits of repairable bridges like the Malo bridge extend beyond just ease of maintenance. They have a significant impact on the longevity and functionality of all-on-4 restorations. The ability to remove the bridge for cleaning and inspection ensures optimal oral hygiene. This is crucial in preventing peri-implantitis, an inflammatory condition that can affect the tissues surrounding dental implants and compromise their stability. Additionally, the option to replace individual crowns ensures that the restoration remains aesthetically pleasing and functional over time. The use of advanced materials further enhances the durability and biocompatibility of Malo bridges. Titanium, known for its strength and lightweight properties, is commonly used for the framework of the bridge. Trinia, a high-strength composite material, is often used for the structure, while zirconia, ceramic, and hybrid ceramic, all known for their excellent aesthetics and biocompatibility, are popular choices for the crowns. These materials are chosen for their ability to withstand the forces of chewing and their resistance to wear and tear. Section 5. The long view. Patient considerations and regular follow-up appointments. While repairable bridges like the Malo bridge offer significant advantages, it is essential to remember that the success of any all-on-4 restoration depends on a multifaceted approach. Patient-specific considerations play a vital role in determining the suitability of this treatment option. A thorough evaluation of the patient's oral health, bone density, and medical history is crucial before proceeding with the procedure. Equally important is the commitment to regular follow-up appointments. These appointments allow the dental professional to monitor the health of the implants, assess the fit of the bridge, and address any concerns the patient may have. Regular professional cleanings, coupled with meticulous at-home oral hygiene practices, are essential in maintaining the long-term success of all-on-4 restorations. By addressing both the technical aspects of the restoration and the patient's individual needs, we can ensure optimal outcomes and improve the quality of life for individuals seeking to restore their smiles and oral function.